joining us. Today is really an important milestone in our series of these webinars that we started.
शायद मुझे आवाज नहीं आ रही, प्लीज।
अच्छा, जी वलीद, देखो कि क्या वजह होगी उनको।
क्योंकि मुझे तो सही आ रही है आपकी आवाज से।
हाँ, बाकी सबको तो सही आ रही। एक मिनट उमर साहब, ये देखें कि अगर आपको वकार की आवाज सही आ रही है, क्योंकि मैं तो थोड़ी देर के लिए बोलूंगा। वकार, आप
देखिए,
कैन यू हियर मी?
जी आपकी भी, बस आप बोलिए दोबारा प्लीज।
जी अब आ रही है आवाज?
बस बहुत थोड़ी आ रही, बट एनीवे आप बोलिए, थोड़ी थोड़ी आवाज आ रही मुझे।
थोड़ा आप उसके अपने कंप्यूटर को कि में भी वो जो वॉल्यूम है उसको ऊंचा कर दें, या सेल फोन या कंप्यूटर का वॉल्यूम ऊपर कर लें।
जी मैं उसको
अच्छा, तो I was saying thank you for joining us. We started these webinars on 31st of March, actually. So it's been 6 weeks that we have done these. We did initially every night, that was Pakistan's morning, 8 o'clock. But when Ramadan started, we changed it to only weekend timings. And now Pakistan time is like 7 minutes over 5 o'clock. And so we will have to actually be cognizant of the Seri time, which will be, I think, in one hour, 10 minutes. So we have to wrap up before that. So today's program is really, really important because it is setting the stage for a really supporting our frontline healthcare workers who are dealing with COVID-19 patients, and in the process are obviously getting burned out, some anxiety, some fears, fatigue, work-related fatigue, and all sorts of psychological problems. Some do fine, but others can have really one main worker in America, in a lady doctor who was the ER specialist in New York City, committed suicide. So that was really, really sad. She was on the forefront and dealing with all the COVID-19 patients. So that led to our Dr. Waqar Azeem. I'm very thankful to him. He led and collected this fine, really chosen academician in psychiatric from all around the world. And this group is tasked to see how we can support the healthcare workers in Pakistan. And we will start with the Rawalpindi Medical University, and one unit at a time, and see how we can develop a program where we talk to them as a group or as an individual, if needed, to support them and find out what are they dealing with. So with that introduction, I will invite Dr. Waqar Azeem, who will give his opening presentation, and then I'll introduce panelists one by one and ask them to give their experiences in 3 to 5 minutes. Thank you, Waqar.
Thank you, Dr. Shahid. Thank you so much for the introduction. It's a pleasure. I know most of my friends and colleagues in Pakistan, UK, Middle East, and US who are online. I'm especially thankful to Professor Omar, who joined us today. Then all my APPNA MERIT team, Dr. Shahid, Dr. Danish, and Waleed, and all the APPNA leadership. I see number of participants online is around 70. And I know my friends and colleagues, I will mention especially cities which are online. Quetta to start with, always remember Quetta, Peshawar, Karachi, Multan, Faisalabad, Lahore, Rawalpindi, and Islamabad. And we have friends and colleagues from UAE, Qatar, and Saudi Arabia, and then from UK and US. So I'm very happy to see so many people joining us today. It's such an important topic. And actually, we were seeing a lot happening on this front. And there was one Facebook actually wording or picture which I saw, which led me to take this initiative on with all my friends and colleagues. So I will start with what are the main objectives of this presentation. Waleed, can everybody can see my screen now?
Yes, Azeem, I can see you.
Thank you. So the main objectives are, first we will talk about impact on emotional well-being and mental health of our frontline staff. Then secondly, how we use self-care to help our staff. Third is, what is the role of leadership? And then fourthly, what are some of the future directions? So I was sharing with you what I saw just a few weeks back. And these are our two young heroes, Dr. Rabia Tayyeb, fresh graduate from Bahawalpur, Qaeda Medical College, who recently passed away in Holy Family Hospital, Rawalpindi. May Allah bless her soul. And then Dr. Albert Coker, who's actually final year anesthesia resident, who I was coordinating with when I was thinking about this, because he expressed very well how was it like for him when he went through the whole process of intubation of Dr. Rabia and later on. So I will share in his own words. I was the last person she saw before dying. These thoughts flooded my mind, our face in front of my eyes. It was the evening of April 28th. I was called to intubate a COVID-19 patient. Knowing the drill, after dawning, I reached the ICU. The nurse greeted me and pointed towards the bed and said she was a doctor. I gazed at her and my heart clenched. She was our kind. She was so lonely, nobody besides her. Breathing appeared like an ordeal for her. Equipment was prepped and I stood on her bedside, ready to put her asleep. I briefly asked her history. She recently graduated from Qaeda Medical College, Bahawalpur, was about to start house job, had no comorbid conditions, no contacts, no travel history. She was dyspneic and anxious. I gently touched her forehead and told her she was in good hands and everything shall be fine. The nurse held her hand and asked her, "My dear, we shall take good care of you. Don't worry, you will be fine once you wake up." But deep down my heart, I knew she was heading down the vortex. With a heavy heart, I again reassured her and asked her to remember Allah, recite whatever she knew. While I sedated her and put her on the ventilator, and all her dreams were put asleep along with her in a moment. She went peaceful once asleep. Being an anesthetist, I know I'm the last person they see and the first one to when they wake up. But this was not the usual case. She was fated to the ultimate destination. And then the grievous news came and I realized I was the last person she ever saw. But she didn't wake up to see me again. Reading this gives me chills that what this frontline anesthesia resident has to go through. And this is just one thoughts or feelings one person expressed. And I'm pretty sure a lot of our frontline staff are going through the same kind of feelings and emotions all over the world. As Dr. Shahid was mentioning, this came in New York Times on April 27th. Dr. Lorna Breen, she was a very well-known ED physician in New York. Top ER doctor who treated virus patients dies by suicide. She tried to do her job and it killed her, said the father of Dr. Lorna M. Breen, who worked at a Manhattan hospital, hit hard by the coronavirus outbreak. So we can imagine what can be the severe impact, which I was just mentioning.
Sorry to interrupt, Dr. Waqar. We can't see your screen. At least I can't see. I'm seeing only the panelists. So can you please check?
Waleed, can you see me a screen?
I mean, I can see you, but I can't see your share screen. It was coming earlier before the whole meeting started when you were trying initially. But now we are just seeing the
Waqar, did you click share screen button on the bottom, the green arrow?
I think I did.
Can you do it again? Yes, now, no, that's not, still not coming.
Can you see now?
No.
screens.
शेयर स्क्रीन कीजिएगा जो बॉटम पे आपने स्टार्ट में की थी वहां से कीजिए
शेयर स्क्रीन करके तो पावर पॉइंट के प्रेजेंटेशन
पावर पॉइंट आपने जैसे स्टार्ट में शेयर की थी
Trying to see, I can't see at the bottom.
वो गैलरी व्यू वगैरह वो करते हैं ऊपर उसकी वजह से ना हो रहा हो whoever is the host ऊपर से व्यूज चेंज करने की वजह से शायद स्क्रीन ना नजर आ रही हो
नहीं ये गैलरी व्यू तो ठीक है
जी अभी अभी मैं असल में
now it's starting
जी जी ठीक
I think it's
जी पावर पॉइंट आप कीजिए
हाँ अब शेयर करें वकार पावर पॉइंट शुरू करें
Can you see it now?
Now we can see you absolutely.
You can see the screen also.
see the APPNA MERIT to your email I think or something
Right,
yes,
right. No, it's fine now, Waqar. Now you can start the show.
it's okay.
Slideshow.
Can you see it now?
Yes, we can.
ठीक है. Yes, now
That's
it's
fine.
Absolutely.
You
Okay,
can see it now.
let's start.
So I just shared the objectives. I talked about Dr. Rabia and Dr. Albert Coker already. I talked about Dr. Albert Coker's experience, which I just shared. I just shared about the New York Times news. Just moving on. So COVID-19, as we know, is an unprecedented situation, which has created big time crisis, leading to a lot of anxieties and emotions in a lot of people. But good thing is that a lot of us are experiencing it together, and we can do a lot together. So when we think about what kind of injuries can happen with the pandemic, one is, of course, life-threatening injuries that some of our colleagues who ended up in ICU, some passed away. So what kind of trauma that leads to that person and their families. Second is when we lost our loved ones or our colleagues or our family members, then there's a grief injury which a person goes through, which included denial, anger, depression, and then acceptance. Then a lot of times we are seeing some moral injury. I give you an example of moral injuries. For example, healthcare professionals have to choose who goes on a ventilator and who does not go on a ventilator. So that is kind of an example of a moral injury. And lastly is what we call a burnout or fatigue injury by repeated stresses, whether it's emotional or physical, how we feel emotionally and physically. The impact on mental health is huge. 11 to 20% of care workers are developing emotional, behavioral, or somatic symptoms. I saw a recent report came from United Nations, and they were quoting at least 3 countries. One was Canada, second was China, and third was Pakistan. Actually, I saw some work from Dr. Asad's group in Rawalpindi looking at the impact on the healthcare workers, and it was anywhere between 30 to 60%. For various symptoms like anxiety, depression, fatigue, PTSD, burnout, those kind of things. What are some of the fears what our healthcare workers goes through? For example, thinking that they will get infected or risk of separation from the families, unsure about their ability to work in the situation, or as we all know, shortage of PPEs. So what we can do, so I will talk very briefly so there can be more interactions. So there are a lot of things which we can do with positive coping, and there's a lot of resilience which plays a part in this. Some very basic principles, actually, you will hear it all the time. that ensure adequate sleep and physical rest is probably one of the most important thing. Think balanced diet, how you use your free time. So not looking at all the news related with COVID, regular exercise, even if it's in a lockdown time, even in homes, anything you can do, and avoid too much caffeine. Lot of times we think about things which we can't control. As a frontline staff, I think it's important that we think about what we can control. So what you can do is how you promote your own safety and well-being. There is a lot that you can control. For example, your schedules, how much time you spend with your families, how you work out with your routines, and then perform hygiene practices, social distancing, and minimize the risk of exposure. Some of the other things, what we think about doing self-care, actually look at some of the positive sides that hopefully some of us have some time to stay connected with loved ones where you didn't have time to make calls or hooking up on the phones. Also, this gives you some more time to spend with the family. It's important how you limit exposure to social media and rely on credible sources. Also, maintain separation from work and home time. In a crisis, it's easy to forget things that bring us joy. Create joyful experiences for yourself. Go out for a walk, watch a movie, read a book. Don't feel guilty about experiencing joy. Some of the other self-care things I think are important, especially in our culture and in our countries. Spirituality, faith, and prayers can be a big help, especially in Ramadan. I think a lot of people rely on it. And at the same time, don't deny the emotions which you go through. So you should have some chance to reflect on things on yourself and with the group you work with. Finally, all the institutions and all the departments, you have to think about honoring your service and that of others can also foster personal and community wellness. You do a lot. Take a moment to let that soak. You are amazing. Also give a shout out to your colleagues. So how you project things in a positive way, I think is very important. Actually, I was looking at some of the meta-analysis done with emotional and mental health well-being of physicians and nurses. And what was found, there were about studies, about 27 studies since 2008, which they found especially anything related with meditation, or cognitive restructuring can make a big difference in your emotional well-being. So like, for example, taking deep breathing exercises, progressive muscle relaxation, mindful exercises, meditation. But it's important that you set some time aside to do these kind of things. So it can't be just random. So you have to put some aside for that. And there are some apps available. For example, meditation guide from New York Times is wonderful. I was trying it last night, which is 1 minute, 4 minutes, 10 minutes, which gives you some ideas how to do these kind of things. Talking about being positive, like coronavirus, behavior and emotions are also contagious. Spread hope.
Screen.
Can you see my screen?
Yes.
Spread hope, optimism, happiness, and compassion. Avoid spreading doubt, pessimism, cynicism, shaming, and blaming. It's the same thing, but how you present, and especially the leaders, how you present yourself and how you do interactions with your colleagues is very important. Be a role model for others. I think just to say a few things about leadership, I think in this time of crisis, you all are playing a huge part in how you lead your troops. And I have seen that, especially since the Vice Chancellor is online from Rawalpindi Medical University, I've seen him doing a lot of things in different units at night time and daytime. I'm pretty sure that is happening in all over the world and especially in all the hospitals in Pakistan. So visibility and role model is very important. how as departmental heads you review your work schedules of your staff, ensure fair distribution of workload, monitor health of your staff, uh, consider introducing psychological first aid training. I saw Dr. Asad Tamizuddin doing that recently, training on that, and how you learn from each other among various teams, like if it's in the same institution, for example, if it's King Edward or Faisalabad or Karachi, how you learn from each other among the units and from different institutions. It's important for our new staff that we should have some kind of a buddy system, because we can't have just our inexperienced staff just throw in to this, like our house officers, how you do some support and compassionate rounds. I was recently attending compassionate rounds by Yale, which they do regularly, in which they bring it in the family members also, which I thought was wonderful. Some departments and some institutions do regular communication, which is, I think, extremely important. People look up to it, whether it's daily, weekly, bi-weekly. I think there needs to be some kind of a pattern how you do communication as leaders. Some town hall meetings, and then celebrate successes. What kind of things have gone well? Honor the dedication, commitment, and sacrifice of healthcare professionals. Some of the things institutions can do. So for example, if somebody gets sick of COVID, some institutions are doing, not using that as sick days. Some institutions are helping that staff don't have to pay anything out of their pocket when they get sick. Having readily access to mental health care. How we able to establish a dedicated hotline, whether it's for institution, for province, or for the country. Childcare, parking, especially for our young staff, that some availability of food, that they're not running after the food while doing long shifts. I think our departmental heads can play a big part, how they do debriefings with their staff when they are faced with these kind of situations. I'm not talking about psychiatric department. I'm more thinking about our medical departments, surgical departments, how they do it in a supportive, non-judgmental, positive way. And the process should be how we learn from what has happened in last 24 hours or last 1 week, that how it has affected someone for their sense of safety, what kind of changes has happened in the people, how do they able to connect with other people, do they feel confident to do some of those things. So I think positive debriefing and supportive debriefing can go a long way in supporting your staff. This is kind of a brief summary from WHO, which I talk about all the things, how you use the social media, sleep, exercise, avoid drinking, smoking, how you handle the information, how you handle the TV, and some of those things. So just kind of in a short summary. As Dr. Shahid mentioned previously, hope is with these APPNA MERIT seminars and along with the local teams, that hope is that we should be able to do some sessions, whether it's kind of debriefing sessions or compassionate rounds with the individual units or departments behind the locked doors. So like kind of doing through IT, not broadcasting to everywhere, so we can have some relationships with individual departments and institutions. This is a start. I've been reached out by a number of folks who I know, colleagues from Pakistan, UK, US, and Middle East, who want to be part of these webinars, and they have a lot to share what they're doing in institutions. So this is a start, the first one with these 7 panelists, but my hope is that we will have at least 2 or 3 more webinars from different panelists from different cities in Pakistan, as well as from UK and US, and how we share resources and experiences. Some of you might have seen this a joke. One of my staff from my hospital sent it, thinking, Dr. Azeem, you might like this. Notice from Psychiatric Association, dear citizens, during the quarantine time, it is considered normal to talk to your walls, plants, and pots, but kindly contact the psychiatrist if they reply back. So with this, thank you so much. I will give it to my moderator to invite our panelists to give their comments and hoping to have a wonderful discussion. Thank you. Dr. Shahid, all yours.
Thank you, Waqar, for a very nice opening presentation. I hope our guest of honor, Vice Chancellor Umar, may have solved or resolved the technical difficulty. Today, I apologize to all the attendees and panelists that for some reason, for the first time in our series, we had a lot of technical difficulties. Some people cannot hear, some people cannot see the videos and presentation. So we apologize for them. Hopefully we continue to go, and we'll share all the presentation with the attendees so that they can catch up on that. With that, I will invite our guest of honor. I will invite our guest of honor, Dr. Muhammad Umar, who's Vice Chancellor of Rawalpindi Medical University and a role model for all of us in RMU alumni and students, to welcome our panelists and attendees and say a few words in the next 3 minutes.
Thank you very much, and Assalamu alaikum, everybody. I really obliged and humbled for this invitation and the part of this very august panel. I think the world has completely changed in this COVID era, and in last 2-3 weeks, I have been the part of so many webinars. So I think this is a new era, new change in the history of medicine. As long as the Rawalpindi Medical University and allied hospitals are concerned, we have treated more than 1,000 patients in last 2 months, and about 500 healthcare workers are dealing with these patients, including me as a chief and hospital chief, and then the multi-specialty consultants, ICU, and even the nurses and paramedics. And very unfortunately, Waqar mentioned that Dr. Rabia died in our ICU because of this COVID infection. And let me explain to you that just a minute, that she is basically arrived so late that she was in shock when she came into the emergency, and then promptly shifted into ICU. And I think she has a stay in Holy Family hardly more than 30 hours. And unfortunately, she couldn't make it. May Allah bless her soul. When we are, this is the 70th day of this COVID pandemic in Pindi and Pakistan. And I mentioned about 500 to 600 workers who are dealing with this patient. And it is not issue only with the healthcare workers. We have a very sort of difficult to manage the patient who are never convinced that they have, this infection and they are supposed to stay in the hospital. I can imagine, I can't see, but Asad is around when he is called at midnight that, the patients are breaking the window and furnitures, and they are not convinced. And then we realized that it is not only the quarantine, it is not only the treating patient in ICU, it is the issue of the psychological issues, stress, and behavior issue. And from last 2 weeks, we have involved our Institute of Psychiatry, and I think the Dr. Asad is the pivot behind this. And last, I think Saturday, we spent whole of the day, starting from 10 a.m. To 3 p.m. I was there whole day. And that we are, educating and counseling our young doctors, about 100 in number in Holy Family Hospital, and about another 50 healthcare worker in the Rawalpindi Institute of Psychiatry. Because there are many doctors who were tested because they think they are not at risk, but their families at risk, their parents at risk, their children at risk. And I remember 2 doctors who resigned from doing this duty, and they were very depressed that they are leaving the institution when this war is at the climax, but their husband and their family won't. And then I talked to their husband and I asked, okay, fine, you don't resign, you stay with the other patient, and gradually we'll see if you can see these patients also. So the point I'm highlighting is the issue is such a heavy burden, and it is such of importance that this is a first disease which is not affecting the patient, but affecting the doctors, not affecting them physically, and they are prone to even death, but they have a lot of psychological stress. And this is, I think, high time that this APPNA team, and particularly Shahid Afiq, I must congratulate and mention Shahid Afiq, who is pivotal. I was just sleeping when he asked me that this is the time to the webinar. This is at least shows his commitment that how he is involved in all this activity. I think these webinars are very useful, and inshallah, our institution, I mean Rawalpindi Medical University, Professor Asad is our leading team, and all hospital staff really will be the part of these webinars, and we are really benefiting from this. And I once again pray and hope that in the leadership of Shahid Rafiq and other members of APPNA, this very healthy and very useful activity will continue. I think the COVID has teach us not only treating patient, but now we are becoming the part of global community, and this global community in the field of knowledge and treating disease, as already said by Dr. Waqar, that the knowledge and disease has no boundaries, and Corona doesn't have to take any visa to travel out of 212 countries, affecting millions of the people. So I think the right team to join hand and join our resources to save the humanity, save the mankind, and boost our healthcare worker. With these comments, I thank you once again. I can't see you, but I can hear very clearly that thank you once again to the whole team, and particularly Dr. Shahid Rafiq and Dr. Waqar. Thank you once again.
Thank you, Dr. Umar. That was very nice. We know that Rawalpindi Medical University has always been our premier partner. Whatever we want to do, APPNA MERIT in Pakistan, we always look towards Rawalpindi Medical University to start, because of your leadership and readily available resources from your university. Thank you again. So now I welcome our panelists one by one and ask them to please present briefly in about 3 minutes, because we unfortunately today wasted time in technical issues. So we would like to wind up all this session with some interactive Q&A at the end before iftar. So we need to be mindful of that, and so all panelists are requested to finish their presentation in maybe 3 minutes, so that more question and answer can be we have at the end. So with that first panelist, I would invite my honor to invite Professor Imtiaz Ahmad Dogar, who is Chairman, Department of Psychiatry and Behavioral Sciences in Punjab Medical College and Faisalabad Medical University. And he is also the President-elect of Pakistan Psychiatric Society. Professor Dogar, thank you.
Thank you, Dr. Shafiq and Professor Dr. Waqar for giving us this opportunity. I wanted to highlight some of the activities carried out by our department and our university, and later I'll be focusing some of the aspects of Pakistan Psychiatric Society. I hope you are hearing me. Everybody is hearing me?
Yes.
Clear?
Yes, we are hearing you.
As constituent hospital of Faisalabad Medical University, which is Ghulam Ahmedabad Hospital, that we declared as dedicated facility for treating such cases, and all the departments, they are collaborating over there with medical department, our pathology department, pulmonology, our ENT, and then critical care department. And then our vice chancellor, he has arranged counseling sessions for nursing staff of all the 3 hospitals, paramedical staff, medical officers, and then assistant professors onward. Separately, of course, keeping in mind the SOPs regarding counseling sessions and donning and doffing of PPEs as well. And later on at university level, we are now doing treatment sessions from house officers to medical officers to prepare them for the upcoming task. At departmental level, what we did is more of telepsychiatric services. Initially we started, but now we are doing OPD with the screen. And what we did further at departmental level is more of WHO coping stress during COVID-19. It was translated in Urdu and it was distributed among our doctors and patients and families, as well as helping children to cope with stress during COVID-19. We did translate this as well. And then at departmental level, we developed psychosocial guidelines for management of COVID-19 patients for frontline workers, particularly related to anxiety, depression, PTSD, then stress disorders, as well as in some of the cases it's psychosis or dissociative disorders. And we developed some of the guidelines based on this American Medical Association, WHO, and some of the Chinese work published in Lancet. And we have developed for our doctors how they are going to keep themselves safe. And then 3 of our department faculty members, they participated in this psychological first aid online training workshop organized by Dr. Asad at WHO Collaborating Center. And now they are going to train our department and the rest of the doctors at our institute. Regarding activities of PPS, if I say, all the members, they started providing telepsychiatric services at their institutes and in their hospitals, and all training centers located at major cities of Karachi, Lahore, Shah, Quetta, Hyderabad, Multan, Bhagalpur, Faisalabad, even Ahmedabad. They started training of their trainees, particularly psychiatric trainees, to the role of mental health professionals in this pandemic. And PPS organized its executive meeting in the April 18th to discuss current scenario and the role of PPS in the pandemic. And many of the decisions they were being taken and they are being implemented. Individually, many consultants, they arranged online talks for general public regarding their panic, anxiety, and other fears, concerns related to pandemic, with special emphasis on maintenance of psychosocial, especially healthy living during lockdown, and addressing issues of stigma attached with this. That is something people would hide and they were not coming for treatment and they would run away from police and other doctors. Then Pakistan Psychiatric Society organized a campaign to draw attention of the government towards the impact of COVID-19 on mental health of people in general. And our president, Professor Dr. Afridi, in collaboration with all the executives, helped the Ministry of Health Services for development of guidelines of psychosocial support for healthcare workers during this COVID-19 pandemics. And our institute at Rawalpindi, Dr. Asad and his team, with input from executives, they are doing this draft proposal for this National Action Plan for mental health and psychosocial support for COVID-19 pandemics in Pakistan in collaboration with WHO. And they have started the training and multiple departments, they are collaborating and they are helping, particularly related to the psychosocial aspect and counseling. And we are ready to help the patients, general public, and our colleagues specifically for which we have organized this workshop regarding their support and helping them in managing their patients as well as their own health. Thank you very much for giving us this opportunity.
Thank you, Professor Dogar, for a very kind introduction to not only your institution's efforts as well as the Pakistan Psychiatric Society, what they will be doing in the coming few days. Now, next, our next panelist is Professor Tayyeb Tahir. He's a consultant liaison psychiatrist from University Hospital of Wales, and he's joining us from Cardiff, UK. Professor Tayyeb.
Assalamu alaikum, Shahid bhai. Assalamu alaikum, Professor Umar. I don't know if you can see my slides on your screen.
Not yet.
Not, I can't see.
Okay, I won't waste your time sharing slide. I'll just run through what we have done here in Cardiff. From about 5th of March, things started going pandemic here in Wales. Fortunately, Wales has been very strict on social isolation. I'll focus specifically on work with the staff. My own interest pre-COVID was occupational mental health. So we have done cognitive behavior therapy in people who are referred through occupational health services. And these are people who are not doctors. So doctors, nurses, and other health professionals are particularly difficult to engage when it comes to mental health. So we had to try and put our energies in trying to engage them. And whatever Umar talked about, I've tweeted my little one-page summary of psychosocial interventions for health workers. And Professor Umar, if you remember, I sent it to you via WhatsApp as well.
I remember.
We tried, because if you look at the documentation, there's so much of information from across the world that it was difficult for putting it in one page. So I spent quite a lot of time just putting a very summarized version, which is easy to read. And this is now available to all my colleagues in the general hospital. And what we did was, as a liaison psychiatrist, we work in general hospital. So we are, from a mental health point of view, we are the ones who are engaged with our colleagues in general hospital. We are more part of general hospital rather than psychiatry network. So we engaged with our colleagues in general hospital, trying to make sure that they are open to discussion, approaching them through personal contacts. But we also have psychologists in different departments, not from my department, but they are embedded in other departments. We contacted them and we tried to think of look, listen, and link principle, that they look into their mental health, the professionals who are working on general wards, look into their mental health symptoms, listen to their own body and mind telling them what's happening, and then also try to link up with one of the mental health professionals. We've thought of the criteria in terms of Maslow's criteria. Not everyone would need to see a psychiatrist, but they need a good, friendly, listening ear. And it was important to think of what Waqar mentioned, leadership. Needed to be in a leadership role, not necessarily appointed, but try to engage with people across various networks. So we have been very fortunate to work with people across the countries. I've worked with some colleagues in Canada. We designed a symptom checklist. I'm not talking about questionnaire, the hospital anxiety depression scales. We just looked at some symptom checklist and made it available to people who work in the COVID cohort and non-COVID cohort. Personal, my experience when I've been in PPE or examining patients with a mask on and a shield on, it's not easy. So encouraging them to take breaks and be able to talk to family and friends was very important. And you can't do it sitting in your office. You have to be involved with your colleagues on the front line. There's a huge rugby stadium here in Cardiff, which has been converted into 2,000 bedded hospital. Fortunately, we didn't need to use all 2,000 beds. We still have about 30 patients there, and it's likely to remain open for rest of the year, depending on what happens. So we've supported staff in that hospital. There are other Nightingale hospitals across UK. We set up a network, and now I'm involved in 2 research projects. One is specifically looking at UK-wide mental health outcomes for staff working in field hospitals. And then there's a local project, which is assessment of long-term consequences, both physical and mental health related consequences of COVID-19 infection. And that could be a very interesting study to look at, because not only they're getting their biometrics done, their biochemical and immunological studies done, but at the same time, you're going to follow them up at 3, 6, and 12 months to see what impact COVID-19 would have. But it's been a very, very busy time. And I've networked with people like Asad Tamizuddin and Professor Brigadier Muaddad Rana in Pakistan with the Red Cross campaign that they're doing. So may Allah protect us all, and with prayers for all our colleagues who have lost their lives and have been unwell. I stop here with a request that please stay safe. It's not a very nice illness.
Thank you, Dr. Tayyeb. Now we will move to our own Professor Asad Tamizuddin, who's a professor and chair of Institute of Psychiatry at Rawalpindi Medical University, which is a WHO collaborating center for mental health in Rawalpindi Medical University. So please, Dr. Asad, 3 minutes. Dr. Asad, can you hear us?
सर मेरे ख्याल में उनका वो इशू सॉल्व नहीं हुआ ट्राई किया हमने
earlier we were trying I'm again apologize for unknown reason of so many technical difficulties, but I think we have to move on with the with our program. So after that is Dr. Salma Malik, who is the Training Program Director, Child and Adolescent Psychiatry Fellowship, Institute of Living, Hartford Healthcare. She's also an adjunct assistant professor of psychiatry, Weill Cornell Medical College, and assistant professor of psychiatry in University of Connecticut. She's joining us from Hartford, USA. Dr. Salma, please.
Thank you so much for inviting me. Assalamu alaikum, everyone. Hope everyone's doing well. I would like to, given the constraint of time, I was thinking of, telling or talking a little bit about why we are feeling the way we're feeling. So just providing some context about some of the feelings all of us have been experiencing, which could be, anxiety, helplessness, fear. So let's try to understand that together. So all of us have seen different kind of unpleasant or traumatic experiences, whether it's natural disasters or terrorist attacks or whatnot. The difference between this pandemic and the previous experiences, that in the past experiences, that there is a start and end to it, right? So with this pandemic, we don't know when it's going to end. And that creates an incredible amount of uncertainty. And we as human beings don't do well with the uncertainty. And that sort of triggers our stress response. And us as physicians especially are not trained to do well with that. So I think it's important to understand as leaders in your systems in terms of how and why the people are feeling like that. The other thing that's important to know is that it's pervasive. By that, I mean that it has impacted us in our work life, in our home, with our children, with school, colleges. So there is no escaping from it. And some of the coping mechanisms that we were using, like going to the gym or going to the movies or restaurants or hanging out with our friends, we're not able to do that. So that sort of also contributes to the stress. So I think from a neurobiological point of view, it's important to understand that whenever your stress response is activated, it really shuts down your thinking brain, which is your cortical center. And what is activated is your lower brain in simplistic term, which is your, amygdala and brainstem. And what does that do is that it responds to fear, and it's more reactive. And that's why you see some of the stories that you guys are sharing, some of not so smart solutions. We've seen hoarding, we've seen folks presenting with extreme denial, and on the other hand, presenting with a sort of a very paranoid behavior or completely callous behavior. So I think as we are listening to our staff, it's important to understand where they're coming from so that we can provide the intervention and help them regulate themselves. So I think in terms of what our hospital at Hartford Healthcare in Connecticut is doing is, I'm just going to mention a few things. And then I'll be happy to answer in the question and answers. I'm going to call it 5 C's. One is communication, and I'll talk a little bit more about that. The second is connection. The third one is compassion. The fourth one is creating a culture of safety. And the fifth one is channeling our fears and anxieties appropriately. So let me elaborate a little bit about communication and tell you some of the examples from my organization. So right now, what our leadership is trying to do is communicate what's called risk communication. And what does risk communication mean? It means that you're sharing information about risk. You're sharing information, what is the meaning and significance of that risk. And along with that, you're also pointing out about what are the actions, policies, and procedures that are going to be implemented to mitigate that risk. And what does that do is that creates a sense of trust. It decreases the stress, and it allows your staff to return back to their functioning or their roles. Now, this is a very sort of an art of communication, right? So you have to, at the same time, you have to provide accurate information, but not alarming information, right? And it has to be packaged in a way that you instill a sense of hope and an inspirational message for your team so they can move on from that sort of fearful and anxious state to now more of a functioning role. And so what our institution is doing is there is clearly corporate daily emails and messages. At more of a division level, we do morning huddles. At 8 a.m. every morning, there's a Zoom huddle, and we check in with each other. So our trainees and faculty are there, and that provides us with a grounding for the day, and also updates us in terms of what's going on, and because it's an ever-changing thing that's happening. We also do a lot of Zoom check-in. Me as a training director, I check in with my fellows twice a week, and that's a safe environment for them. It's sort of a process group where they talk about their fears, anxiety, they can talk about their personal issues that might interfere with the job performance, and that really helps them in terms of moving on. As I said, connection, which means, emotionally close, and, moments of human connection are so important. Compassionate, wellness, the culture, I just want to speak a little bit about that. It is so important to create a culture of safety in these times. And by that, I mean blame-free, free of stigma, coercion, and no fear of any retribution or negative consequences. Only then the people will be able to move, as I talked in neurobiological terms, from their lower brainstem functioning to more cortical functioning. You have to regulate their emotion in order for them to understand what you need to say as a leader. They will not be able to process the message if they're highly unregulated emotionally. With that, I thank you for inviting, but I will be happy to answer any questions later on.
Thank you, Dr. Malik. Next is Dr. Nazish Imran. She is the head of the Department of Child and Family Psychiatry in King Edward Medical University and Mayo Hospital, Lahore. Dr. Nazish, please go ahead.
Dr. Shahid and Dr. Waqar for giving me an opportunity to be part of this webinar. I'll just focus in the next 2 minutes or so three aspects. One is the services for support as well as patients, which we are providing at King Edward Medical University. Some of the evidence generation, which we are doing, as well as some of the challenges which we are facing in our work. Now I'm working in Mayo Hospital, which is a 600-bedded hospital, and it was declared as the main center for COVID-19 patients early in the outbreak. And later on, the 1,000-bedded Expo Field Center, so that was also given to Mayo administration, and the doctors from Mayo are also covering that field hospital as well. So even sort of in the first week of March, when the cases starting coming in, we did realize that the staff were feeling very frightened. There were a lot of concerns. So we approached the university administration, and we were very lucky that in the first week of March, the university notified a staff support service, and I'm the focal person of that service for our university, so that the staff can access confidential advice or any stress-related symptoms, so they know we are there to help them. We also sort of started working with the patients who've been admitted. Currently, there are almost 400 patients admitted in Mayo Hospital, and sort of almost half of the Expo Center is full as well. So we are working with them, providing services. One patient tried to commit suicide. There are a lot of issues on ongoing basis. So we are trying to sort of support them as well as the medical teams. We have done lots of psychological first aid sessions with our own residents, our own staff, and later on linked in with the medical team, separate groups for consultants and separate groups for residents. So that's an ongoing activity, and that has been helping us as well to learn from medical team, and it's a vice versa learning experience from all of us. We have been involved in more than 7 projects in our university at the moment, starting from, we did a survey of our healthcare professionals as a baseline in the beginning, and we observed almost 35% of them suffering from anxiety, acute stress problems, as well as depression. So that manuscript has been submitted, and just yesterday we finished data collection of more than 9,000 residents across Pakistan, looking at their stress-related symptoms and so on. So it would be interesting to see, because compared to March, now the things are quite sort of different. And we feel that the stress level of residents, especially the junior staff members, it is pretty high. So we are looking at that sort of, we shall be analyzing that in the next week. We've done systematic review of impact of quarantine among children, and that has been submitted as well. We translated the guidelines for individuals with autism and intellectual disability in Urdu language, so that is available numbers. We are looking at it in Mayo Hospital, younger children, so how it's impacting them as the families. Has both, as well as with the patients. So that's we are working on what could be done to decrease the impact, both short-term as well as long-term consequences. So these are some of the research projects which are sort of going on in the university. The thing which we felt helped us a lot as well as was the linking in with the medical teams. So those joint sessions, listening to them, what difficulties they were facing, what options we can provide. So working together as a team in linking with the medical team, I think was the best experience which we had. And it helped them to realize as well that how important psychological impact and the challenge which we were finding, majority of the problems arising were of administrative nature. And the medical team with more biomedical approach, they were at a loss as to how to address these issues, and they were not aware. So psychological first aid helped them to actually employ those strategies in their day-to-day work, which definitely did decrease their own level of anxiety and stress as well. So these were some of the things which we have been doing. And just last week, hospital administration also requested us to do the sessions with the doctors working in Expo Center. So that's going to start from tomorrow. So I think it's an ongoing work as the disease is evolving. We are learning from our own experiences, and we are hoping to have a long-term follow-up with the doctors as well as with the patients, to see what are the long-term impacts of the illness in our healthcare workers. So that's we've been involved in, and thank you again for the opportunity. And if there are any questions towards the end, I'll be happy to answer.
Sure, Dr. Nazish, thank you. Sorry again, we did have some disturbance in the sound quality during her presentation, but like I said, in the interest of time, we will keep moving on. And the next panelist is Dr. Mohammad Zishan, who's an assistant professor of psychiatry in Rutgers State University of the New Jersey, and he's joining us from New Jersey, USA. Dr. Zishan.
No, thank you so much. I just want to highlight 2 things. First, what Dr. Salma Malik said about, whenever there's a stress, the lower part of the brain get activated, and our cerebral areas are not that much active. So a couple of simple things that can help our cerebral cortex to get activated. And one simple strategy is called name it to tame it. Like just naming our feeling, like either we are feeling sad, we are feeling angry, we are feeling frustrated, that can help us to activate our cerebral cortex. Because a lot of research is showing that our healthcare providers, they are good at, they feel they are resilient and they are good at hiding their emotions. So just name it to tame it, like what they are feeling. Second thing, a lot of time, I think we see that people are not accepting this or getting more angry or more irritable and expressing a lot of anger. So what we have found is that a lot of time when someone come with those concerns, so even a mental health provider or even a family member who just start jumping on giving a solution, why not you do this, why not you do that. But the best way, again, to activate, one of the best way to activate your upper part of the brain is first to validate that person feeling. Like if that person is feeling angry, we validate that, you know, you seem angry. Second thing, we will collaborate, we call it collaborative thinking, to understand rather than just judging or assuming that this might be the reason this person is getting angry or frustrated. So we try to understand what has been happening in that person's life, and then try to come up with some solutions. So with those strategies in mind, we at Rutgers University, which is very close to New York, and we saw a significant amount of cases. So our hospital was one of the main hub for treating coronavirus. So we address at a 4 level. I think one thing we set a sport to manage stress for our healthcare providers with the same goals of listening, understanding. And the second thing what our residents did is they create a social work. It's just like WhatsApp, it's a social media called Slack. So through that platform, they they try to involve all the residents from almost many programs in New Jersey. And then with that program, so if some residents are feeling stressed and they have maybe a 7 p.m. time free, so they just chat, oh, we are free at 7 p.m. if anyone wants to join. So that kind of flexibility, and some were like, I'm free to watch a movie, or I'm free to play this game online. So that kind of activity. The third thing, we just started recently a campaign called Check You, Check Two, which means that we also check ourselves, like our emotions, our regulation, try to maintain our routine, and also try to check two of our colleagues, how they are doing. In terms of medical students, so we are so medical students who are interested in specialty, so we are doing virtual electives for them. And also medical students are also volunteering for faculty who are working, but they need some like sport for their children or kids. Another project that we are doing at our department is called Project Echo, where we are teaching almost any healthcare provider throughout New Jersey state how to cope with this stress. The last one is on parenting, because that's one area that has been brought up many times, both from the general population, like how to parent, how to talk to our kids. So I'm working, and we are trying to work to create a draft where we can help parents how to talk to their children, how to relieve the anxiety. So thank you so much again for the opportunity, and I will answer later if any questions.
Thank you, Dr. Shizan. Our last panelist is Dr. Munal Khan. She is Chief Resident, Recruitment and Wellness, PGY4 Psychiatry Resident, University of Washington, Seattle, USA. Dr. Munal.
Well, first of all, I want to thank APPNA for organizing this very important discussion. When we talk about frontline staff, it is very important to talk about residents. So I'm here to share the resident perspective and share strategies that UW have adopted to kind of help residents during this pandemic. The residents are very different from consultants and attendings. Residents are at a different stage in their life. They mostly live in smaller spaces which are close to hospitals. They have young families, which often comprise of pregnant partners and small children. Sometimes they also live with their elderly parents. These characteristics make them more vulnerable. They're also locked in a hierarchical system and have very little control over their training schedules and their training experience. With any event which has the tendency to cause trauma, 3 things are key: ensuring safety, preserving agency and meaning, and restoring connection. Therefore, I will categorize our efforts around those 3 themes. So for ensuring safety, we prioritized minimizing risk of exposure, conserving PPE, and conserving our workforce. All non-urgent outpatient psychiatric clinics were converted to work from home telepsych models. For inpatient CL service, we shaved down our teams considerably. We had skeletal teams wherever we could. For example, on the CL service, we minimized the risk of exposure through assessing patients, whether by phone or telepsychiatry. And if the attending had to see the patient, our residents were not required to see the patient. We also have universal COVID testing for all patients who are admitted at UW. We got all our residents fit tested and PPE trained. This was actually mandated so that residents don't have to advocate for themselves to take time off for these trainings. All of our didactics and meetings are also virtual. Number 2, preserving autonomy. In preparation for the surge, we created expanded backup call pools, and we also thought about redeployment within psychiatry to, from non-urgent to urgent settings, and also to other specialties such as medicine or acute care. Residents were given the option to opt out from expanded backup call pools if them or their families were at high risk. Redeployment to other areas in psychiatry such as urgent settings or redeployment to other specialties was completely optional. Another feature of preserving autonomy is transparency. Both the university leadership and psychiatry leadership met with residents on a regular basis to address their concerns and to provide direct and open communication. Third, fostering well-being and community support. All psychiatry residents at UW are actually mandated to receive personal psychotherapy. Most of us, especially the R3s and R4s, were already in this, we're already doing therapy before, we're already receiving therapy before this pandemic started, and we have continued to do that during the pandemic, which has proven to be invaluable. We also have regular group meetings with our class, and they are facilitated by group leaders. For non-psych colleagues, such as those in medicine and surgery, psychiatry faculty offered to provide one-on-one individual therapy sessions. We are also in the process of setting up support groups for our non-psych colleagues. For community support, we receive a wellness budget to organize wellness activities. We were encouraged to take those activities virtually now, so social hours, movie nights, online gaming, virtual dinners, etc. Another important feature for residents is childcare. So UW community members from Seattle kind of stepped up and offered to provide in-home childcare for essential healthcare providers. UW also has daycares on the campus. They have contracts with local daycare facilities, and all of that was tapped into to support residents. So yes, these are some of the, I try to keep this very minimal. These are some of the strategies that we have adopted at UW. If there are questions, I will be happy to answer them. Thank you.
Thank you. So now I come to know that Dr. Asad Tamizuddin finally was able to connect to us. He was not in the beginning due to technical reason. So I will invite Dr. Asad Tamizuddin, who is a professor of psychiatry and chair of Institute of Psychiatry, which is a WHO collaborating center for mental health in Rawalpindi Medical University. Dr. Asad Tamizuddin Nizami.
Thank you, Dr. Shahid. I don't know whether you can hear me now or not.
Yes, we can see you and we can hear you.
Okay, that's wonderful. Actually, you were saying that I wasn't linked up. I actually got linked up to your link at 15 minutes before 5. But somehow this was the first time that surprisingly I couldn't get in touch either on the audio or the video. I know you have to catch up with time, and please ignore if I may repeat something, because I know Professor Umar is here and he may have talked about some of the measures that we have taken already at the Rawalpindi Medical University. But since your main aim is to focus on the frontline workers, in Pakistan, you know, the dynamics are very different when we look at the number of patients we have and the number of the frontline workers that we have to employ are massive. So I think we made an action plan which is being shared by almost all around the country. This action plan was also focusing on the frontline workers. Just yesterday, we had some workshops, as you already said, that the Institute of Psychiatry, which is an academic unit of RMU, is also WHO collaborating center. So we have a plan of dissipating the psychological first aid to almost all the frontline workers. So yesterday we had one session, we had almost like 50 people, starting from clinicians, senior registrars, going to medical officers to the paramedical staff. So we equipped them with the psychological first aid. This is a WHO document available online. The institute has translated in Urdu. And we also have done a basic survey of understanding how stressful they are. So we use some of the skills of understanding their distress. Secondly, we did another session with the house physicians, the newly ones who have to join in with the isolation and quarantine. I think we did an assessment before and after to find out their distress level also, and we have been able to provide them with the psychological first aid. Just last week on a national basis, we have been able to train almost 107 residents and psychologists, not from one place, but all over the country from different various centers on the same psychological first aid. So these were some of the areas which we thought that we need to equip at least our frontline workers so that they're able to carry on their work. We do have a helpline also, which is not only for the patients who are COVID positive, but it's also available for those residents, house physicians, medical specialists who may have any kind of social issue, and they can link up with us. So that's being advertised, and that's being known to everybody. One thing I would also mention is that the WHO has developed a very cohesive plan for the region, which is the Eastern Mediterranean region. And the WHO office is linked up, and the Rajahmundry Medical University, three of the facilitators are working together. So this plan also focuses on how you're going to look after the mental health of the frontline care workers. They have outlined each and every area of how you're going to take it up, how you make an assessment. So we are going at par with what the regional framework for WHO is, the country office is doing it, and obviously what we're going to implement. So I think to catch up with time, this is some of the areas where we have worked, and we are very successful in it. I'll be very happy to answer to any questions that anybody has. Thank you.
Thank you, Asad. I will invite Dr. Waqar Azeem to see if he wanted to acknowledge other people who in attendees and maybe take few questions before then we close, and I'll ask Dr. Umar to for closing remarks at the end. But I think we have very little time for maybe one or two questions, but Dr. Waqar Azeem, go ahead and acknowledge some.
Thank you so much. First of all, I will thank all my colleagues, all the panelists for doing such a wonderful job from all over the world. I'm very thankful. Especially want to acknowledge, I see a number of senior colleagues and friends online. Professor Iqbal Afridi, I see, who is president of Pakistan Psychiatric Society and Dean at Dow Medical School is online. Thank you, sir, for online. Inshallah, you will be one of the future panelists. And I see Professor Ghulam Rasool from Quetta online, Professor Rizwan Taj from PIMS, Islamabad online, Dr. Farooq from Rawalpindi, Dr. Anjum Bashir from UK. Thank you all. And then there are a number of cities which I didn't mention in the beginning. I see Gujranwala, Jamshoro, Hyderabad online. So it's great to see so much interest in this topic. I think this is the maximum number of participants we have in any COVID seminar. I think it was around 76 at one point. So I'm very grateful to all of you who presented and attended. I will leave up to the questions. I see one question, especially for Professor Imtiaz, if you'd like to take this on. I can read the question for Professor Imtiaz. Can you hear me?
Yes.
So there's a question. Assalamu alaikum. I'm Dr. Altaf Parvez Qasim, Medical Director of Tertiary Care Institution, i.e. Abwa Hospital, Faisalabad. It's nice to see very respected Professor Imtiaz Dogar. My question is with Professor Dogar. Most of the healthcare providers, including doctors and paramedics, have developed psychosocial issues, rather irritable behavior during COVID-19 pandemic situation. How to deal with this situation? Professor Imtiaz, all yours.
I think if he's not there, then any other person can take
How
it up.
about Professor Asad? You want to take this on?
Yes, sure. I think that's what we have been doing yesterday. So the question is that if you look at the WHO website, the first thing they're saying is that this is a normal reaction to an abnormal situation. So most of us will get irritable. Most of us will have a very different kind of behavior. Now that's what we as population need to understand, that all of us in a very different situation. So I think most people who may show anger outbursts or who are maybe irritable or who are agitated, our job as the frontline workers are the same thing which they say in the psychological first aid. Listen, look, and try and understand. So I think what we need to do is to look at these people who have these difficulties, listen to what their difficulties are and try to find a problem for them. But if you start labeling them, no, he's agitated, he's aggressive, he needs an antipsychotic, I think that's where we're going to go wrong. Very quickly, I just quote an example from last night. I'm talking about 2 a.m. in the morning when we got a message from one of the quarantine centers that patients who had their PCR test negative got it positive the second time. They were preparing to go out, and then in anger, they locked up all the doors, and then I had to communicate with my colleagues from the Rawalpindi Institute of Urology on phone to make them understand, look, we're there to help you. So these examples are going to emerge. What we need to understand as clinicians, there are normal reactions to abnormal situations, must listen, must find out what we can do and do a problem solving for them.
I think I'll just take 2 questions and then we'll close it. We have other questions and we will try to answer them in the future webinar. I'm sure we'll have to do not even 1, but 2 more such sessions. Dr. Wasim Alvi, can you are unmuted. Can you ask your question from attendees?
Yes, thank you, sir. It's a pleasure to join and be among all these distinguished professors and psychiatrists. So I wanted to ask that from all the panelists that people are not, even after 50 days of lockdown in Karachi. I'm from Karachi and I work as a psychiatrist in prison. And we had 40 inmates tested positive yesterday and 2 staff members. The problem that we're seeing in the society is that people are, even after so much media awareness, are not able to comprehend the seriousness of the illness, and they're not ready to take the precautions, and then they're having the dysregulated emotions. How are we going to counter it as a psychiatrist, as we are going to guide them? How do we approach this problem? Because this is a dilemma. As the more we try to convince, the point that the honorable professor was making, that people become irritable. So that's what I'm trying to ask. Anybody can wish to answer this question?
Dr. Nazish, do you like to respond?
Anyone else? We have to move on. And
Dr. Can I answer, Zishan?
Sure, Zishan. Please.
Yeah, I think couple of things. First of all, I think what Dr. Asad mentioned too, about one further step is that as a psychiatrist or as a even family member or as a physician, if someone is getting angry, someone is getting irritable or not able to convince, the thing that we have to remind ourselves that we do not need to get angry at them. Because if someone else is angry and if we are getting angry, it's just, if one spouse is angry, another is angry, things can get worse. That's the first thing. Second thing is, I think with the family therapy model is we try to understand keeping why they are thinking that way. Either they are financial constraints, there may be some other reason. So that may give us some empathy to understand why, either there's a lack of education, so many issues could be there. So understanding, keeping in their mind in perspective. And third, I think what Dr. Asad mentioned is to collaborative explore what are the possibilities and then come up with some possible solution. And the solutions could be not that we have to convince, but solution could be some less thing rather than convincing. So it based on individual person, but we have to calm ourselves. We have to keep their perspective in mind, and then talking to them, understanding what has been going through, come up with some possible solution that could be doable. Thank you.
Waqar, can I say that first and foremost, remember, you need to make sure that you don't start labeling people with mental illness, because that would be very difficult to maintain long term. It's important to normalize things for these people. We do not have public health messages in Pakistan. We do not have public health as a specialty in Pakistan. And Wasim, in person, we have communicated many times. I'm very proud of Wasim. Wasim used to be my student here in Cardiff. Wasim, you really need to be the public health leader, and the work you do in prison. You need to think of the staff that you are dealing with. Since this webinar was about staff, think of the staff, how they can take the message across. You need to generate that force across through your messages in a networked fashion, giving simple messages. This is going to be long-term situation. We might have long-term social isolation, social distancing. It's very frustrating. We see that in hospitals that we do not have enough space to social isolate and social distance, but we need to keep giving this message repeatedly as doctors, as psychiatrists, as nurses. We need to make sure that we normalize. Normalizing is the key concept here. This is the new normal that we are facing now. Forget about the biochemical basis, forget about the brain structures. You need to make sure you're communicating to people as individuals, not as a doctor and as a patient, because that's going to make a difference. Number of phone telemedicine assessments I'm doing these days, people are grateful for us trying to keep them safe. So giving that safety message is very, very important, as not as a psychiatrist, but as a doctor, as a public health messenger, and making these forces, networks of people. Use youth, medical students. I've used medical students to give this message and take that forward.
Good. Thank you, Dr. Tayyeb. One last question. This is the final question, and again, like I said, we will address the questions in the next session. This is from Professor Bilkis. You're unmuted. Please ask your question very briefly, because we are running out of time. Then I'll ask Dr. Umar to close the session.
All right. Assalamu alaikum. First of all, I'm really impressed by this wonderful webinar, and I would pay special thanks to Dr. Nazish Imran for her special services at King Edward Medical University in providing us sessions on psychological first aid, both for the consultants as well as for the young doctors. My question from Dr. Nazish is, what is the experience regarding telepsychiatry recently introduced at King Edward Medical University?
Answer, yeah, yes, okay. Yeah, I mean, as you're aware, sort of telepsychiatry service has been running right from the beginning when the OPDs were closed and so on. And it has been overall a very wonderful experience, and gradually we are getting calls from all over Punjab, from rural areas who are not able to travel, and there were psychiatric issues. And majority of the calls are just general stress-related problems by children, parents, or people who do not had any psychiatric illnesses before this pandemic. So they have been contacting, and they are aware. So awareness regarding psychological impact of the pandemic is increasing. At the same time, the services which we are providing to the COVID-19 patients, that has actually been a wonderful experience, giving us insight into how those patients are suffering, and what can we do in order to make this quarantine and isolation in hospital easier for them. And I think once the pandemic is over, there's a lot of scope for telepsychiatry services, and it will be a different world from what we have been used to. So it has been a wonderful learning experience for all of us involved in provision of services via telepsychiatry.
Thank you, Nazish. So,
Dr. Shahid, can I add just one sentence? I'll take a second for it.
Okay.
Very fortunately, Rawalpindi Medical University has become the first institution possibly in Pakistan that we are using this telemedicine for intervention. And there's a program which is called as the PM Plus Intervention Program developed by the WHO. So from the Rawalpindi Institute of Neurology, we online using tablets. We are the first one to initiate this program. We have got official permission. And I think it's because of the Vice Chancellor, Professor Muhammad Umar, and his effort that we are going to do the pilot of this program, the PM Plus intervention in Pakistan. Thank you.
Thank you. So I'll finally ask, I thank you from my side, all the panelists, attendees. Sorry for some technical difficulties, but all in all, it had been a very, very useful and great session. I'll ask Vice Chancellor, Professor Umar, for the closing remarks in 1 minute or 2 minutes before iftar.
Thank you very much. Pleasure and honor is all mine to thank all the panelists, distinguished participants who really were very exciting to attend this webinars. I think this is very useful activity, and I will request the the Merit, APPNA, and Dr. Shahid to continue all these activities. I think the world has become the global village, so this is a great opportunity to learn from each other. And Rawalpindi Medical University always very keen to be collaborative partner of all these activities. I thanks once again to everybody, and I again feel privileged and honored to be the part of this webinar. Thank you very much indeed.
Thank you, Dr. Umar. After the Ramadan, there will be new timings. We will do 11 a.m. Eastern Standard Time, which will be 8 p.m. in Pakistan on Saturdays and Sundays. That will be our new timings after the Ramadan. But we have one more session next Saturday. So we'll see you there. Please keep joining us. Thank you all. Stay safe and stay blessed. Assalamu alaikum.
Thank you all.
very much.
Okay. Take care.
Allah Hafiz.
Thank you. Assalamu alaikum, everyone.
Dr. Waqar and Dr. Shahid.
Gigi.